I'm Brad Stuart, general internist for over 40 years and specialist in hospice and palliative medicine for the past quarter century. My co-authors and I are excited that our paper, Finding Hope and Healing When Cure is Not Possible, is coming out online and in print in Mayo Clinic Proceedings. In our paper, we don't discuss what to do or say to seriously ill patients and families. Instead, we describe ways to be, inner attitudes that we can cultivate as clinicians that may help us assist them to make the difficult transition from curative to comfort-focused care. All of us authors have had firsthand experience with serious illness. I practiced for years in the hospital and the ICU before I went into end-of-life care. And I've spent time on the other side of the table as a cancer patient. Those experiences led me to create a program at a large integrated health system in Northern California to keep seriously ill patients out of the hospital and to receive care at home if they choose. This program, I'm happy to say, is the foundation of a new clinical and payment model that will soon undergo national testing and a Medicare demonstration. Our other medical co-author, Dr. Raina Audish, is a pulmonologist, intensivist, and medical director of care experience at Henry Ford Health System in Detroit, Michigan. Raina has survived her own catastrophic illness. She spent months in her own ICU, gaining many insights from how her own colleagues treated her. Our third author, Dr. Tracy Danaher, is a professor at Monash University in Melbourne, Australia. Her extensive experience and eloquence made major contributions to this paper. And our senior author, Dr. Leonard Berry, is Regents Professor at Texas A&M and Senior Fellow at the Institute for Healthcare Improvement in Boston, Massachusetts. Both Tracy and Len are health services researchers specializing in care delivery improvement and patient experience. You might recognize their names from their previous publications in Mayo Clinic Proceedings. Our paper focuses on healing for parents of young children with incurable brain tumors. We chose this topic because of our own personal experience and also because it's hard to find a better example of the need for healing. But the approaches to healing we describe in this paper can be applied to the care of patients with incurable illness at any age or with any diagnosis. Healing near the end of life is not about mending the body. It's about regaining wholeness when bodily integrity has been lost. You don't need a whole body to be a whole person. Healing is a process of internal exploration and growth that can help seriously ill people experience wholeness and well-being, maybe in ways they haven't before. Clinicians can facilitate this process if we reflect on and work with our own internal reactions to our patients' vulnerabilities, fears, and hopes. In fact, healing depends on the natural evolution of hope. Hoping, like healing, is a process that encompasses a lot more than hoping for a cure. That's just the first stage, which we call focused hope. It's objective, focused on outer goals, so it lives and dies with the prospects of cure or recovery. But if illness progresses despite treatment, focused hope must fade. If it doesn't, it becomes false hope. Then what we call intrinsic hope may emerge. This is when people start to pursue more subjective goals like quality of life or search for a deeper meaning. Finally, as death approaches, we may come to hope for freedom, not just from pain and the burdens of disease, but also from the bonds that may have sustained us throughout our life, but can oppress us as we prepare to leave it. If you spend time with people as they're dying, you can sometimes watch all these burdens lift. These stages of hope don't evolve in predictable ways. They emerge, fade, reappear, or even coexist. It's a different journey for each individual. And we clinicians are on this journey ourselves. Our hopes should also evolve because the alternative is hopelessness that can lead to burnout, depression, or worse. Outcomes that have become distressingly common and relevant for physicians. It seems we may need to heal the healers, and we can help this process along not by doing anything special, but by being unconditionally present with our patients and ourselves. That way, we too might discover a new kind of hope, and along with it, renewed resilience, adaptability, and maybe greater satisfaction with our work and with our lives. My co-authors and I appreciate your attention to these issues, and we encourage any open discussion you'd like to engage in together about them. Thank you very much.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.